This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week my guest is Stacie Addy. She is the clinical manager of hospice. Are you the clinical manager of hospice?
Yes, I am.
She is the clinical manager of hospice. Let me do that again. Hi, Stacie. Welcome.
Hello. Thank you.
Thank you. So, hospice. I have questions about hospice. First, I have to say this. We're recording at the lovely Joan and Diana Hospice Home. And it's one of my favorite, I think it is, my favorite building, my favorite place to visit on all of the KRMC campuses.
Thank you. We try and make it be a home. This is their home, not a hospital or institution. We just really want it to be welcoming and calming and serene for them.
I've recorded a few different times here over the years, and I love it here. And it's away from the main drag a little bit, and you've got the mountains and the beautiful view out here. Of course, open desert up to the side and this little garden out back. It's beautiful. And then the main room, there's this big high ceiling. And the other thing is this. There's a certain feel about coming into the hospice house, a certain feel about the people here. You know what I'm saying?
Yes. Very calming and here to help.
Yeah. Today is a recording day for me, and I was at a different clinic earlier, and I won't mention which clinic that was, but it was clear that there was a hospital drama going on, and I don't think that's divulging any trade secrets. Just some days are better than others in healthcare, and you're talking about diseases, and you're talking about... Anyway, there was some tension in that office, and, a lot of wonderful, caring people there, but something was happening.
Our goal is to help actually relieve some of that stress for the families. Yeah. This is a time for them just to enjoy their loved ones. They don't need to worry about anything that might be going on at the nurse's station or anywhere else. This is just time for them to be with their loved one. And
that's just what I'm talking about, right? Because I was sitting there and I was like, okay, I'll get through this. And I can't wait to go over to the hospice home later on because it has this certain feel about it that's... There's a certain sort of person, I think, attracted to hospice, right? I mean, it's a special calling.
It is. It takes a person that truly has heart. It is here for a patient, a person, a family. You have to have the heart. Yeah.
I mean, you are dealing with people right at the end of their lives. And these are people for whom, we spend so much time and effort and money in medicine trying to prolong life. And then there's a point at which we say, this person's life is nearing its end.
And we are here to give them comfort. If there's something on their bucket list that they've really wanted to do, we try and help fulfill that. And it's just to be here to support not just the patient, but we're here for the family too. Yeah. It's a whole picture. It's not just one individual. You're a family all together.
Stacie, you are an RN. How did you find your way into this particular line of healthcare?
I was actually working in a small 26-bed hospital in Iowa, and they just asked if I would come over and be willing to learn it and try it, and I fell in love.
Do you recall when they first asked you if you would go? What were your impressions?
I was a new grad. I was eager to learn everything and anything I could.
Any assignment that came along, right?
And once I did hospice, I knew I wasn't leaving it.
Yeah. Tell me about that, because as an outsider, I feel like, again, people are passing all the time. You're there to sort of ease the transition. And so I get that there's probably a real sense of purpose. Although, is it sad? Is it...
It is not. I am giving them the best gift ever. I am giving them comfort. I am giving them dignity at the end of life. We know it's coming, but we can either make it peaceful and dignified, or they could have a horrible death. And let's make it as easy as we can and comfortable.
Yeah. Was it challenging when you were first learning, you were coming from... again, I keep thinking that medicine has so much that orientation of, pound on that patient's chest. Come on, save that person's life, right?
It was very hard. I came from actually ICU, so it was very
so
hard
it's the
acute.
Opposite, right?
It was.
Yeah.
My boss, my first patient that I went on my own, she told me, you will stay in that house for an hour. You need to, because ICU, it is very fast paced. Yeah. She said, I don't care if you just sit there and stare at the patient. You will stay there for an hour. I will say it is the longest hour
Really?
that I've ever had to do.
Yeah.
But it also made me really learn that you just need to listen to the patient, and sometimes they just need somebody there with you, and you need to slow down and really listen.
Yeah. That's the whole vibe of this place, is that time, I mean, you walk onto this property and time starts to have a different feel about it. I'm not just imagining that, right?
It does. No, it does. It has its own little feel here.
Yeah.
It's just kind of a calming, soothing presence.
I just think about how much of my life and our lives in general, we're just racing, just trying to cram in every moment, trying to cram in something else, right? And I mean, I guess it's debatable. I don't know how much more meaning we really get out of life from trying.
It just makes you really realize and appreciate the small things in life. Yeah. It's not the material stuff. It's the small things, your family, everyday little things.
And you have families come in here. Well, okay, let's take a step back. I want to ask about hospice because if I'm not mistaken, there are two separate tracks here. There are two separate lines of care, right? There's one at this hospice house. Correct. And then there's the home care.
There's outpatient and there's the hospice house.
Okay.
Our hospice house, we have 12 beds. We usually utilize 6. We have, if somebody is at home, they're having symptoms that we've tried controlling there, we can bring them here. We kind of have nicknamed it our mini ER for things like that. We also have a caregiver needs a break. They just need some rest. So then they can come in for 5 days of respite, and the caregiver can just kind of get some rest, do the things that they need to do for themselves. If they don't take care of themselves, they can't take care of the patients. We do every once in a while have somebody who is here long-term. That is not normal. Usually these beds are not for long-term. It's mainly short-term.
How do patients come to you? Is it by referral, or can a family member just call?
We have lots of family members that will just call. Yeah. We have family members. Yesterday, one walked in the door to the hospice house and said, I need help. How do I find out about hospice? Yeah. We'll sit down. We'll explain it to them. We do need a doctor's referral. We'll say, talk to your doctor, or we have Dr. Mahmoud Khan is our medical director, and he will also see patients.
Oh, okay.
If they're in the hospital, the hospitalist can refer, nursing can refer. We've had families say, we're in the hospital, please come see us, come talk to us. Mm-hmm. So they come all different ways.
Okay. When a patient is involved in hospice, then what's the range of services you provide?
For outpatient, we bring skilled nursing into the home a few times a week. We have certified nursing assistants who can help with daily cares. We have volunteers that can come help sit with patients if you need to run to the store. We have social workers. We have a bereavement program. We have lots of bereavement to where they even have children's programs. We have chaplains. There's a whole group. And you can kind of pick and choose what you want. It's a big pot. You take out what you want. You may say, want to volunteer this week. Next week you don't. The following week you do. That's okay. We're flexible. That's the wonderful thing about hospice is it's not rigid, set in stone. We can really get creative to help meet the needs of the families.
And I understand, there's always a need for volunteers here. Is that
there
right?
is.
Yeah.
Our volunteers, some go in homes.
Right.
We have some that sit at our front desk at the hospice house and greet families. Right. We have some that come in and bake cookies. That's one thing at the hospice house. There's always fresh baked cookies here for visitors. There's a wide variety that volunteers can do if they're not comfortable with patient care. So there's many opportunities.
I want to give this number at the end, but just since we're talking about it now, for volunteers, or if someone's listening and saying, oh, that is something I need to do. Do you have a phone number handy for volunteers? I
do. You can call 928-692-4680.
One more time.
928-692-4680 and ask for Luann.
Uh-huh. And she coordinates the volunteers.
She does. And we have trainings a few times during the year that she will set you up with training. And if we have a great volume for it, we can add more training as we need it.
I just wanted to touch on that now since we were talking about it. I know also you have certified staff, and that is not something you find at every hospice organization, right? What is the significance of having?
There is a special certification that staff on their own can go out, and it is for hospice and palliative care. It really hits home of how to provide the hospice and palliative cares. Okay. It can be for nursing. They're talking medications, just how to listen to a patient, signs and symptoms to look for. It's just really specialized. We have 3 nurses, including myself, that are certified. Our medical director is certified in hospice and palliative care.
Yeah. Are you doing a lot of administrative stuff? Are you still going on the floor and doing nursey stuff?
I kind of do both.
Yeah.
I do try and round the hospice house every day to see patients, see how things are going. There's times this morning I helped and I was CNA because our CNA had a meeting to go to. Yeah. You know, I go where it's needed. Right. I do work out of 2 offices because I do cover outpatient and our hospice house.
You have, how many people are you coordinating then while you're doing all of that?
We have about 25 employees.
Wow. Mm-hmm. Yeah. And so then the people who are going and doing home visits, do they have some central location or do they just, there's an office on Stockton Hill that is just for outpatient staff. And it's just it's offices, and they start their day there and make their phone calls, kind of coordinate with other staff. Right. The hospice philosophy, it's very important that we work as a team. That's what this is based off of. We meet every Wednesday. Our medical director comes, all of the staff. We discuss the patients, how, maybe somebody's having an issue that they've tried something and they want somebody else's opinion, that maybe somebody else has seen this and they've had something that worked. So it's really working as a team. It's time for a quick break on Focus on Your Health. We'll be back in a moment for more with Stacie Addy. Stick around.
There are code breakers with lines well tied, traces sweeping out across the static night. You are draped in white like the blossoms of the tree, looking down a glass.
And welcome back to Focus on Your Health. I'm TG LaFredo, and this week my guest is Stacie Addy. She's the clinical manager of KRMC Hospice. I know in many fields of medicine, there's always research, there's always some new advancement coming along. When you're talking about when you're talking about birth and death, are there that many changes? Do you have a lot of changes that come along that you have to keep up with?
There are some, and I think it's more the changes are of what area you live in. I was in the Midwest. There was medications we've used that they have not used here. I came here. There was medications that I did not hear from back there. I think it's great to integrate them together. The hospice world does work very close together to try and share ideas. It's not so much competition. It's how can we help each other to better serve the patient.
Right. And you worked in some smaller facilities in the Midwest.
I have.
And Kingman is a medically underserved community. That's not a secret.
No.
We have some wonderful people here. We just don't have a lot of people here. We have a lot of people who need care. And I wonder about the challenges particular to working, especially hospice, in a medically underserved, a rural, spread out kind of area the way Mojave County is.
Our biggest challenge is patients having a caregiver.
Yeah.
That when they are unable to care for themselves, that we've seen a lot of people don't have family, so they don't have a caregiver. So it's trying to find a safe situation for them to live in, whether it be in a facility, if we bring them in here for a little bit. That's our biggest challenge is no caregivers.
The people who don't have anyone,
our social workers really work to try and get access started. That does take a good 3 months to go through. We are a nonprofit.
Yeah.
We really do try and help.
I guess what I'm wondering is, how do they initially come to your attention when they don't really have anyone? I'm imagining
right at admission, we
Right.
kind of start talking, okay, as the disease progresses, do you have family? Do you have friends? A lot of times we do see friends that step up.
Right.
If not, we start talking, here's different facilities in town.
Right.
Maybe you should go look at them. Is there something we can assist? Or maybe find some private caregivers to come in.
I'm wondering, I guess there are a million stories, but I'm just wondering, are these people who have outlived their family members, or are they, maybe some of them are
It's just a mixture.
Yeah.
Some have outlived them. Some, as I've been in Kingman, I've realized it's a lot of people have just moved from different areas.
Right.
It's kind of a mixture here, and so their families aren't here.
Right. You have a lot of people to take care of in a lot of diverse situations.
We do.
Go ahead. Sorry.
I mean, we go out to Peach Springs also. I mean, we do go onto the Indian reservations. We serve many different cultures and people.
And it's challenging work. I guess what I'm wondering is, and of course, people are passing away. That's what happens at this stage, right?
Yes.
It seems like there's got to be some danger for burnout in this line
There
of
is.
work.
And I will say our bereavement counselor, she is wonderful. Her name is Rhoda. She really looks out for all of the staff, especially if she knows somebody kind of had a hard patient, that they kind of got really close, or there was just something that really hit them hard at home. And she really looks out for us and will take some one-on-one time with us to help so we don't do the burnout.
Yeah. And you've been in hospice care for 9 years. And
Yes.
I'm sure you've had, what is it? It's a personal note. You don't have to answer. No, but I'm wondering, what are the ones that really resonate with you that you say, oh gosh, this one hurt. This one was tougher for me.
I think it's the younger ones. Yeah. And I know my first one that really hurt, it was one that the father was the same age as my husband. I had children the same age as this, and actually my child ended up going to school with this other one, and they did not know each other, and somehow they have become best friends, starting in preschool.
Really?
Mm-hmm. They're both 8 now, and they still talk to each other, and it's neat how it kind of circles around.
And so the gentleman who passed was the same age as your husband. Is that
He was, and it's hard when you can relate it to your own home, your own home life.
Yeah. An aspect of this related to this is that you have chaplains who are part of the program. Can you talk a little bit about them?
We have a full-time chaplain named Denny, and we also have Leonard. They are non-denominational. They are here to support you spiritually in all different capacities, and wherever you're at in your life, they're there just to help support and guide you. Yeah,
I was looking at the literature somewhere here about hospice, and it said something like, no one's trying to convert you.
Correct. They're not. Yeah. They're not. They're just here at whatever place you are in your life to help support that. Mm-hmm. And, some people, they don't get to a point and they say, we don't want a chaplain, and that's okay too. Right. We do, as time goes on, we remind them that they are here because some people do change their mind. Right. So it's not to push any religion on anybody. They're just here to support you in whatever place you're in.
Got it. Something you touched on, and this is possibly dangerous territory, but you touched on, I want to ask you about it, a nonprofit organization versus the other kind. I mean, KRMC is a nonprofit hospital. You said to me that you've only worked in nonprofit organizations. I have. I feel they are more here to serve the community than it just be a business. We get to care about our patients. Nonprofits, in my experience, I've noticed they give a lot more. Yeah. They do, supplies, nursing visits, just, it seems like you really are with your patients more. And for you personally, this aligns a lot more with your mission, what you need to do. Yeah. Yes. In the for-profit nonprofits, I can personally say for myself, I could only do nonprofit. Yeah. I know Hospice Home is also involved in We Honor Veterans, which is a special program. Can you tell me a little bit about that?
That is a program where it is for hospice patients that anybody who has served, Army, Navy, at any time, that we do honor them. Different programs do different services. We have a social worker named Liz. She makes up a nice little certificate and frames them for every veteran, and they get a little pin that is a flag. We do try when the patient passes that the funeral home puts the flag over the coffin or over the body as they're leaving, as a tribute of respect to them for what they've given to us.
It's really
so
nice.
We really try and honor our veterans.
Yeah, that's really nice. I wanted to ask you, I know there are some what's the right term? I know there are some memorials here.
There are.
On the grounds. Can you tell me about those?
Our first thing we have is brass butterflies, and we actually just had a new tree. It is a metal tree that was made for us because we needed more room for butterflies, that you can, for a $30 donation, you get a butterfly. You can have engraved something on there like in memory of, and put your loved ones' names. We also have on our back wall, there's a brick where you can put a memorial, and that is $50. We have a couple trellises back there. We have a beautiful back garden area that patients and family, it's open to them all the time. And you can donate a trellis. That's at a $200 level. And then we also have the $500 level, which is on the memorial wall inside the hospice home.
Will you take me back there and show me around?
I will. So this is our, as we call, butterfly garden. We have different seating areas. It's just very quiet and tranquil. It's just a place for them to come out and just admire the scenery and just relax. We have different trellises here, as you see the different seating areas. And this is just kind of their little peaceful sanctuary, as we'd probably call it.
Yeah, I like it a lot. It's really pretty and quiet, and it's a little windy today, but
it is, and beautiful views. And you were talking about our rooms. Every room has a view to the mountains. When they designed this, they wanted every room to be able to have a view.
Take me on the okay, so we talked a little bit about the butterflies, and I see some of them over here. Tell me about those, would you?
This is where you can do a memorial and put your loved one's name on there, a little saying if you want. We have many families that will say, I'm just here to see mom or dad, and they come out where the butterflies are and just do a little reflection time. So this is just to kind of keep the memory of everybody going.
It's really sweet.
This is our new kind of pride and joy in our backyard, is our new butterfly tree. As I said, we had ran out of room, so somebody graciously has built us a metal tree that we can add butterflies on to remember our loved ones. It's called the Tree of Life. It was made by Mark Kraegler. He is actually the spouse of one of our hospice nurses. He's in welding, and so he took on the project.
It's a beautiful job.
Thank you.
It's funny, right? It may not make for good radio because there's a lot of dead air, but for me, that's part of the magic of being here.
It is. It is just sometimes just the quiet to really do some reflection and just take everything in.
That's Stacie Addy. She's the clinical manager of hospice at KRMC. Stacie, thanks so much.
Thank you so much.
As a reminder, KRMC Hospice is always looking for volunteers. If you'd like to help out, give a call, 928-692-4680, and ask for Luann. That's 692-4680. And that's the show. That is Focus on Your Health. I'm TG LaFredo. Thanks so much for listening. If you'd like to get in touch with me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health, foyhradio@gmail.com. We'll catch you next week.